first presentation I gave to you is fighting the growing problem of antibiotic resistance in Germany. The first slide are the financial disclosures, like everybody else, and my agenda. First thing is I will talk to you where I come from, and I will I'm a pediatrician, I work for my own in the outpatient setting. I want to tell you a little bit how the German health system is working. Then growing antibiotic resistance is a problem of unnecessary antibiotics, and it's a local and it's a global problem. And you heard it already from Mr. Yati, give antibiotics, and also from the first speaker from Litauen, only give if it's necessary. It is so easy, but at the daily work, it's hard to avoid the antibiotics. And I will talk a little bit of the role of phytomedicine in Germany, evidence-based medicine with plants, and what this works in my daily practice. How can I work with phytomedicine? The first thing, where I come from. I'm from Bavaria, perhaps a lot of you heard it. I'm from the city of Nuremberg. It's about approximately 2,000 kilometers. It's a long trip. And it's a pleasure and it's a pressure to stand here, because if you go to internet, you can see during the Second World War, there are really horrible things done by German people in the city. And I think Europe is growing together. And after the Second World War, we have a really good phase. And if you think 10 years ago, we could not imagine what happened the last 5 years. And I think meetings like this and connecting people together, this is one way which lead Europe ahead in a good future. And this is my hometown, it's Nuremberg. Perhaps you heard about the Christkindlesmarkt. We think they are world famous, the Nuremberg sausages, and these are the Lebkuchen. Who did already eat a German sausage? Alexander, you eat a sausage? The only one. So I will send him a few. With me. Let me go to the German health system. The German health system, if you read about German economics, they always talk about the car industry. But we are similar. We have the same number of employees, and we have the same impact on German economy. And this is something changed the last 5 years. At the beginning, we only talk about costs in medical systems. But it's also necessary to talk what we're doing for society, what we're doing for economy. We have employees. We give industry work, and this is really necessary to bring in the societies all over the world. We have a rigid division in the stationary and outpatient setting. In the outpatient setting, you have the primary cares, like family doctors, general practitioners, whatever you call it, all over the world. And you have specialties, cardiology, pulmonology, and this. In the outpatient setting, we named it praxis. It's a world, it only exists in Germany. In the all other countries, they call clinic and something else. We now get praxis. We are a lot of people working outside. 141,000. Oops, sorry, that was the wrong one. So, this one. 141,000 doctors outside, 50% primary care. Our population, about 80 million people. Pediatrician is a hard job because we have not so many newborns, it's less than 800,000. It's similar in Litauen, Ukraine, and in Germany, the birth rate. If you look to Asia, in Philippines, it's doubles. If you look to Africa, there are 4 times children births for 1,000 billion. What's about pediatricians? Are we primary care? Are we specialists? Primary care, you have only education, about 6 months clinical education. For pediatrics, you need 5 years. And in this system, we are both. This is one of our biggest problems, that we belong to the practitioners, but we are specialists. In fact, it's so, in my practice, I run on my own risk. I am responsible for my employees, I have to pay them. And we get about 35 euros for the treatment of a patient in 3 months. And we have a real flat rate problem. In these 3 months, they're coming up to 13 times to my praxis. We have a really high number of patients, up to 120 a day. And the part of my job is like pediatrics everywhere. Examination of development, talking about vaccinations, when to start, what to vaccinate, the discussion you have all over the world, and all kind of infection, especially respiratory tract infections. And these 120 persons were the reason why I'm here. Because Alexander heard me 2 years ago, and he don't believe. And last year he came and visit me in my practice. This is my colleague, and we have a very nice afternoon together, and that's the reason why I'm standing here today. Antibiotic resistance and unnecessary antibiotics are local and global. We're starting with the local situation. This is one open source document. It named Germap 2015. Have a look on the human and veterinary medicine, and it's a stationary and outpatient setting. Because it's very important that if you talk about antibiotics and unnecessary antibiotics, it's not only human medicine, it's also veterinary medicine. But if you look in veterinary medicine in Germany, the advantages the last 10 years are very much faster than in the human medicine. If you look to the outpatient settings, altogether it has 700 to 800 tons antibiotic per year. 85% of this prescription are in the outpatient settings. And you can see it's relatively stable over 2005 to 2014. The blue ones are the doses, 480 double defined daily doses, and the costs about 800 million euros. The problem is we have too much second-line antibiotics, especially cephalosporins. And there's one thing we always talk to our colleagues, cephalosporins are bad guys, because they're responsible for a lot of resistances. And if you look at data from the insurance companies in Germany, I explain it because it's in German, these are airway infection, and about 30% of airway infections are treated with antibiotics. Overall, we think there are only 10% bacterial infections. So the overestimation is about twice as 3 times too much antibiotics. You can also see there's division between the old German federal countries and the new ones. I'll show you later why. The newest data comparing outpatient setting between Germany and Netherlands show that we have a lot of things to do. If you look at the first line, all systematic antibiotics, defined daily doses in Netherlands to 10.3, in Germany 14. And it stays continuous, 14 in 2016 and 9 in the Netherlands. If you go to cephalosporins, we see a really big difference between two countries. They are close together, they have similar systems, but the use of antibiotic classes is totally different. The key points of this study is that the difference between Netherlands and Germany are stable, and it's also the use of cephalosporins, which is a problem in Germany. If you look on the newest data regarding European Union, this is from the ECDC homepage, then you can see the range. Netherlands are the best here in this study. Finland is in the middle, like Germany and also Lithuania, it's about in this region. And if you look on the bottom, you have Greece. They have a defined daily dose about 35, comparing 9 in Netherlands. And if you look at the substances, you can see the green ones are the cephalosporins. We have a big problem with cephalosporins. Bulgaria, Malta, Slovakia, Cyprus, and France, and Greece. And France is bad together, but they had using a lot of penicillins. So the European guidelines are similar. What we're doing with these guidelines every day, at the end of the day, that's totally different. Are there rules? What rules we have in Germany? This is a German story for little children, Max and Moritz. And this is the teacher of Max and Moritz. And he say, you don't do this. They do it either way. And we have a really strong guideline for the hospitals. but we have no good guidelines for the outpatient settings. One example, the new sinusitis guideline for Europe, for Germany is 130 pages. I said no doctor in Germany had read the whole guideline. Perhaps the ordinarius for ENT in the university, but no practitioner ENT doctor had read the whole guideline. So Max and Moritz did what they want. No rules. I have later a talk about antibiotic stewardship. And one idea from antibiotic stewardship, which is really good, is restriction. That you say, if I have a otitis media, I have to use first-line amoxicillin, and I should not use other ones. And this restriction should be in the effective programs in the clinical settings for antibiotic stewardship a good effectiveness. I showed you a few slides earlier. There's a difference between Eastern and Western Germany. And you can see as red is a very high rate defined daily doses, pale are better. And it depends up to 2011, 20 years after reunion of Germany, you can see a really big difference between these parts of the country. And if you talk to the doctors, what's the reason? They say in the eastern part, when we learn medicine, before the wall falling down, we don't have antibiotics. We have to be very restrictive. We have to consider every dose we gave. And this is so much deep in my brain that I don't change my attitude. And this is one thing from my personal point of view which is really important. If you look why the antibiotic rates doesn't drop enough, it's to change your attitude after working 10, 15 or 20 years. It's very difficult. And in the other regions where the rate is very high, the people say very often that the pressure of the patient. I know it's a virus infection. I don't want to give her antibiotic, but the mother wants an antibiotic. What should I do? And this is totally interesting if you look the different regions, and it's also different if you look to big cities or to rural areas. In big cities, the doctor often feel the pressure to prescribe antibiotic if it's not necessary. In rural areas, the doctors say, I have no problem. The patient is doing what I want. Okay, if we go to the global way, we have 4 years ago, the G7 gives in Germany, in Bavaria, and you can see this is the Bavarian way of closing. You could not compare this with the Oktoberfest. This one of the right ones, if you have it's in orange or pink, it's for the Oktoberfest. And at this meeting, the United States have a president, you can make a photo with him. Now it's different. And if you said at the end of this meeting, they make a declaration, and the only one which is left is Angela Merkel. The rest is away. But the declaration is good. They have 10 points which they make important for the politics of the global world. And one of this is antibiotics, antimicrobial resistance. And they figure out that it's necessary that we need a prudent use of antibiotics, and also that we think about alternative therapies. That's what you figured out before, the loss of biodiversity. People are thinking good about nature, and this is also we can go in the treatment of the normal respiratory tract infections. And the WHO also have one of the top targets, optimize the use of antimicrobial medicine. So the global action plan of the WHO says to avoid antimicrobial resistance is one of the big goals to optimize the use of antimicrobial medicine in human and in animal health. And once again, this path is necessary for both sectors, human and veterinary medicine. And what accelerates the spread of antimicrobial resistance is very often treating viral infection with antibiotics. From our point of knowledge, it's not necessary, it's not helpful, it makes only problems. But at the end of the day, we do it. What did the patient expect if he come with a common cold, with a flu to our office? We already heard about a thing I really found necessary, shared decision making for chronic disease, but I think it's also necessary for a common cold. This is from the Robert Koch Institute, the German Health Institute, and the Maker Internet set. And they've asked, what do you expect if you go to a doctor? About 2,000 people. 47 said, I want to be examined, receive advice, or sick certificate. This is also very important. Sometimes they need a prescription for staying at home. But the examination of the people, this is really important, and we see in Germany a big difference between general practitioner and pediatricians and, for example, ENT doctors, which make less examinations than we. The same amount of people, 40%, want something to ease my discomfort, painkiller, cough medication. 20% have no real expectation. They say, you are the doctor, you have to tell me what to do. And the same amount want herbal or alternative therapy. Only 7% in this examination want directly antibiotic. And I told you before, often you feel the pressure to prescribe an antibiotic. But very often it's only a feeling. Very often it's not really the expectation of the patients or the parents. It's that what you mentioned. And I'll show you later on in the antibiotic stewardship one really good presentation from 10 years ago that's necessary that you attach this feeling. Did you really want an antibiotic? Are you sure? Or if you only feel it. It's a totally different. So we changed to the role of phytomedicine in Germany. Phytomedicine is very popular. This is the rate of OTC, over the counter, in German apothekes. And you see there are in the first 10 places 5 phytodrugs. So if the people go to the apotheke, they ask about phytodrugs because it's natural, because it's not chemical, because it's good, it's not bad. And this is one we can do also for children. Because we have in Germany the advantage that we have a few companies which make a lot of research for plant medicines. And I show you 2 studies for children. The only one is for rhinosinusitis. And it's a multi-center non-interventional study for 3,000 children. And if you look at the results, you have 2 different formulations. And you can see the symptom nasal passage, and you in both age group 2 to 6 and 7 to 12 years with both preparation, you see the blocked nasal passage is improved under this formulation. And this is one you can really good use for avoid nase drops. And if you look secretion, the consistency is going better. It's liquid and not sticky. The color is better. So if you look at the assessment by the physician, if he thinks his therapy was good, then he say 55% and 36 in the older age groups the same, it's very good or it's good. And you have the same data for bronchitis with another formulation. Here we see 1,000 pediatric patients in 10 days treatment on 60 different sites in Germany. And to measure the success, they use a bronchitis severity score with cough, dyspnea, sputum, rhonchi, chest pain during coughing, and you have a maximum range of 20. And you can see over those 3 days, day 0, day 4, day 10, again, 3 age groups, 2 to 5 years, 6 to 11, and 12 to 17, a decline of the symptoms in all age groups. This is not a placebo-controlled study, but there is one placebo-controlled study at the middle of 2007, I think, for the adult population. They show this same results also in a placebo-controlled study. If you're interested, we can talk about later on. And a really high responder rate in these 2 groups. No side effects. So I come to the role of phytomedicine in my daily practice. This is, I think, that's a key slide from my 2 presentations. Well, it looks like you've picked up the rhinovirus. If I go to the university, I learned if it's a virus, it comes from alone, it goes from alone. If I heard what you said before, it's not true. We have to talk about if it's rhinovirus or RSV, if you have a bronchiolitis. And at the end of the day, at a common disease with a 7-year-old boy without fever, a lot of doctors in Germany think, doesn't matter what I do. And the most often given recommendation is go home and drink a lot. I've never seen a publication about drinking a lot of water for curing a virus infection. But I've seen a lot of publications for preclinical data and clinical data for phytopharmaceuticals. I never understand the homeopathic hype. I don't understand it. I'm not ready to use it. But this was something I can understand. And if you look at the number of doctors in Germany who are working outside, it's a little bit, half of the people are believing that they could treat a little bit the symptoms. If you think back on my slide, what people expect, they expect your consultation, your examination, and they expect something for the problems they have, for the pain, for the cough, and for the feeling of illness. And they want something natural. So for me in my office, is this wrong that we can do nothing? And we have also this old sign, primum non nocere. And this is also important. 2 years ago I have a presentation like this in the Philippines. And they asked me before, 80% of OTC drugs are using a psychoactive substance, which is not allowed in the European Union. And it's sold in the Philippines because you're feeling better. It's like a little bit being drunk. So it's necessary that we don't give the advice for something dangerous. And sometimes it's really dangerous what's in some medicine included. In my daily practice, respiratory infections are in some days the reason why up to 60% of my patients want a consultation and examination. It's more than 90% of these infections are viral infections. And the Robert Koch Institute, that's what I told you, that showed that 25% of the people wish alternative or herbal medicine. Although the G7 declaration promotes the development of alternative medicine. From my point of view, phytotherapy with evidence-based drugs is accepted by nearly all patients, and I like to work with licensed and proven phytopharmaceuticals. Phytotherapy is for me a very helpful tool to avoid unnecessary prescription and to avoid unnecessary and avoidable resistance. So, a summary. Summary is again, it's the same like I showed you before. For my day, for the thing I work, I'm really glad to have good phytopharmaceuticals to avoid unnecessary antibiotics. So I thank you for your attention and I'm looking to a good discussion. Thank you very much.